Leah, thank you so much for joining us today on Worth Wellness TV. I'm actually just really excited to have a conversation. We just both talked about how we're kid free for a little bit this afternoon. So, like, an excuse for a babysitter. I have to talk to somebody,
Yes.
another adult. So, I'm so excited to get to chat with you about pregnancy and fitness and mom life, all the things I'm just obsessed with right now. So, thanks for joining.
Yeah, thanks for having me. And I'm equally as obsessed with these things and love to talk about them. So excited to dig in and have the conversation.
Yes. And I thought to kick things off, could you just give our viewers an idea of who you are and what you do?
Yeah, absolutely. So, I work for BirthFit. So I am the online programming director, which just means if you're unfamiliar with BirthFit, we are fitness and birth education for all in the motherhood transition. So that's preconception, prenatal, early, and a little bit later on postpartum. And then we do general fitness programming for women that's more cyclical. We talk about cycles and things that are not directly related to pregnancy and postpartum, but just cultivating that community for women that respects that space. So not only do we have, a ton of education for providers, maybe birth workers, chiropractors, PTs, doulas, midwives, to become a birth fit leader, to become educated and teach a lot of the things that we teach. We have that education aspect, but we also have that fitness aspect, very specific to those very important times in the motherhood transition. So me specifically, I write a lot of our online programs. I kind of manage them, overlook them, answer the questions, do the videos, all of that, as well as a bunch of other things. What is a job role these days? We just, you get 4 girls together and we do the thing. Other than that, I'm also a birth doula. And I have been a doula since, I would say, like, quote unquote, officially 2017. So about 5 years. And then I also am a gym owner in the Houston, Texas area. So I've been doing, was an athlete my whole life and have owned a business in the fitness realm for a little over a decade now. So kind of just marrying that fitness coaching piece with working specifically in women's health.
So did you pursue birth work specifically and working with women in that space before having kids, or was that ignited by when you had kids? Like, what made you passionate about that time period specifically?
So one thing is, I've always known that I want children, and I'm not someone who's super like, I want to have all the kids. It's just, and I'm not even someone who would say that, like, I'm like overly in love with kids. Like, I love mine, but it's so funny because it's something that I knew I always wanted, but it was on the back burner. But I love, coaching is a big calling for me in all realms and aspects. And I really gravitated towards the women. I often had like the women's only class, or I just really connected with women because the gym space is such a masculine space. And my husband does that part so well, but we have to balance that out. And so oftentimes it would be, women that would be like, I have heard the same cues for the past 5 years, but when you said it or you explained it today, a light bulb went off. So I've always had that connection with women and kind of knowing that I wanted kids for myself. And I remember I had kind of one of those realizations that I was loving what I was doing, working in the gym, coaching, working with women, but I felt like something was void. And this was well before I was even married, before we ever even had a conversation about like actually having kids. And I remember telling my now husband that I was like, something just is missing. I'm not feeling fulfilled in this space. And the only thing that kept coming up for me was babies. And it was just so like confusing because I was like, well, I'm not ready. Like, I know I want them, but not right now. And what is it calling? And so I remember always being piqued in the birth fit interest. I was like, I'm seeing these women work out, fitness, pregnancy. I coach a lot of women. I don't really know specifically. I know enough to guide them through a healthy pregnancy, but I don't know the details. And I just remember it being really fascinating to me. So it was kind of one of those why don't I dive in and I'll just do, a birth fit seminar and learn this information. And then it's like, when you learn the information, it's game over. You're like, the whole world needs to know this. So that's what kind of started me off. And then from there became a doula, because it was like, what's next? What else can I do? And I felt like doulaing was like, I can take my passion for coaching and working with women. And I've always thrived in intense settings, in the settings where a lot of people back away, like just, black out, don't know what to do. I'm like always the calm, cool, step up, under pressure kind of person. And so I kind of thrive in that. And I think that was like attending births for me. It was like, I'm kind of coaching and cultivating and just like nurturing this woman, but also like there's the unknown and we don't know what's going to happen. And it just called me. So I felt like being a doula was like the next step after I learned all of this birth information, and me being able to get it to more people, but also fill my cup. And, just putting myself in an atmosphere and a space that I felt like I really thrived in.
How do you think that experience of just getting so much birth education and diving into that on a professional level prior to having children impacted your experience going into pregnancy and birth and all of that?
I mean, it did so much. I say that every birth that I attended prior to my own, only made it more clear for me and the birth that I wanted. And I was able to take the experiences from others that I'm witnessing and being a part of and say, like, I love that, or I would love if that was my, part of my story. I will say also the first birth I ever attended was with a wonderful midwife here. And I always say it ruined it for me, because I witnessed that birth and was like, I can't imagine giving birth with anyone else in any other setting. Like, she was just so incredible. She became my midwife and now like really dear friend. And I truly think that she's like the legend of midwives. Like, she's just phenomenal. But it's funny because I just knew in that first experience, it was my first birth, diving in, a lot of unknowns, like, first time you're like, what do I do? Am I doing the right thing? Am I getting in their way? She's 30 years skilled, thousands of babies. And I just remember being like, this is what I want. So, but can't take away from the other experiences that were clear picture of maybe what I didn't want, and how that really helped shape my desires, and planning and having conversations with my husband, being on the same page, things like that. So I would say it even now, like we say we're done having babies, but I go to a birth and I'm like, I love giving birth. That's my favorite part of the process. And I'm like, that was such a beautiful experience. I could do that one more time, just to like have a new experience. So I would say being a doula does not help with the baby fever thing.
Oh my goodness, that is so fascinating. First of all, I'm just so intrigued by you saying that birth is your favorite part, because I think culturally it's kind of the part we dread. Like, it's the part that we're supposed to be like most afraid of and is most scary and all of that. But for you to say that that's the part that makes you want to do it again, like, okay, tell us more. Why is that the case for you?
I just have like the utmost admiration for birth and the whole birthing process. And I think with the education, like you can't unknow what you know. And so it's this different realm of, like, you are the portal that is bringing life into this world. And it's such a out of body surreal thing that I think oftentimes, because of culture and, the way that birth is done 99% of the time in America, like, well, oftentimes women are led to believe it can only happen this way. You're not in control of it. Everything is out of your control, and we're just going to see what happens, and we'll intervene when we need to intervene. And as long as baby is healthy and happy, we're good. And that just never resonated with me. So it was almost like this empowering feeling to step in and say, like, of course we don't get to call how it happens. Like, babies do come the way that they're meant to come. You have the birth that you are meant to have, but there are so many things that are within your control, that like, you were made to do this and the power is within you. And I think I felt really empowered by like being able to write my own story, but also very open to saying that like it might not be that way, but I can control a lot more than just saying it's out of my control. And so, yeah, the birthing, it teaches me so much.
Mm.
Because we always talk about how, like, when you give birth to a baby, you are birthing into the newest version of yourself. Like, you are a mom now, and there's a part of grieving, right? Like, you are leaving the former, like your former maiden self, and stepping into this new realm. And that's a big thing.
Mm.
But so is bringing life into this world. And I think that's the coolest thing. And the ultimate surrender part is like, it blows my mind. There has to be a time and a place in every birth where you just let go. And I'm a control freak. I'm a type A. I've been an athlete my whole life. I'm competitive. And so it's that out of body, birth really happens when you let go of all of that. And you have to be willing to go to that out of body place, to like go within and do this dance with your baby to get the baby out. And I just think it's so cool that, yes, the baby might come different ways. It might be an 8-hour labor, it might be 32 hours, it might be 1 hour, but you get to go there and do this dance and really like open up this world to a new life for the baby and yourself. And I just think, like, I don't have words to describe how amazing it is to witness it, but to also go through it.
That's so beautiful. Thank you for sharing. And I also am a very recovering control freak type of personality. Yeah. And so that's the part I wonder, because I hear over and over again this concept of surrender being really crucial to a birth, and especially I'm doing a free birth and that sort of situation, and hearing from people about what makes you a good candidate, like, oh, great, being a control freak doesn't really set me up well. But I'm curious, from your experience, was it actually in the moment easier than you had anticipated to surrender, let go? Because it's like this, I mean, really, like you said, the out of body, it just kind of comes over you. Or were there things you specifically did to prepare to be able to step into that surrender and be open to it?
Yeah, there were definitely things I did to prepare, because I knew myself as like, I wanted to control. And so some of that was, I did 12 weeks of birth education that like I didn't love doing, but I was like, I want to be the student. Like, I don't want to come in here like I know everything. I want to be open to learning. And I want to experience this with my husband. I don't want to teach my husband. I want to like go through this together. And with that came more, birth planning, and our team, like Lindsay, CEO of BirthFit, was my doula. And we did a lot of work together, but she knows me. She knows where my hangups are and where my obstacles are. And we worked through a lot of that together. So that was a big part of like her just knowing how she can help me, and me solidifying my team, that it was like, my husband is my partner. He is my person. I couldn't do it without him. But like, I want you to be my husband, and I want her to be my doula. And that is two different roles for me, and getting really clear on what that was. And then I want my midwife to be there to do the midwife things, but she doesn't need to do any of the other things. So I think one of the main things was I had the utmost trust, and just being on the same page as like with my team, where I felt like no matter what happens, whether I did need to transfer, whether intervention did need to happen, like they have my absolute best interest at heart. And if that is the way to go, I 100% trust that. And I think that part, like that was part of me letting go. That was part of me saying, you know what, I have the best people that I could possibly have around me. And no matter what happens in this birth, I am supported. I feel safe, and like, I'm open to what happens. But I will say, that going into my first birth, I walked in at 6 centimeters, and she was like, you're in active labor, but doesn't seem very active. So, we can do this, this, and this. You could go home for a little bit. You could do this, come back a little bit later. So when I was finally more active, I came in at like 8 centimeters, 75%, just walking in my head was like, okay, like I'm going to have a baby here pretty quickly. This isn't too bad. And I was holding on. And I think the athlete, the competitor, the being comfortable with uncomfortable things in me was like, this is this is hard, this is intense, but if it just stays right here, I'm good. And I didn't realize it, but I was controlling how much I was willing to let my body go through. And so I was 8 centimeters for 7 hours. And like 95% of faith, like things should be kind of happening. And my midwife came in, like they cleared the room, and they know me so well that she came in and like I needed the reminder. I'm usually giving the reminder, and I needed to hear, you have to let go, you have to surrender. And she's a Christian, she's a believer, and she gave me an analogy from the Bible of Shadrach, Meshach, and Abednego, and being willing to, they were willing to go into the furnace and die to show their faith. And she kind of gave that analogy of like, you have to be willing to die to get this baby out. And no lie, she left the room, and within 30 minutes, like I was in transition and pushing a baby out. And it was just that like reminder that I needed, that it's okay to let go, and I'm going to be okay, and trusting that plan. So I will say the first time I definitely had some hangups. The second time I woke up, water broke, an hour later, baby came out. Like it was just a whirlwind.
Oh my gosh.
So
That's crazy.
I would say between the first and the second, I did learn a little bit more on surrender and letting go. But all that to say that even myself, who knows birth, who attends birth, who gives birth education, I needed to hear it. And that is why I had my team. Because I don't think I would have gone there without somebody having that stern conversation with me.
Oh yeah, absolutely. I think that's why it is important to have some sort of village support system of some sort leading up into birth, because they can see your blind spots. They can see the things that you might get stuck on that maybe you can't, or have those like tough conversations with you when you need it. And I think that's really important. One thing I really like about BirthFit too is just the community aspect of how women are supporting women in this process, and really pivotal time in their life, transitioning, like you said, from maiden to mother, and all the emotional side to that. And then also all the physical side. It's just a total transformation of like who you are, like you said, a rebirth. So going a little bit more into the fitness side of things, because I know that is your expertise. I'm really curious, what do you think is really missing in the world of fitness for pregnancy and postpartum moms, or even preconception? And what are you doing to help bring more awareness to what it looks like to really nurture the body in all of these stages for women?
Yeah, that's a great question. If I had to sum it up easily, and we can expand, but the one thing that is missing in the fitness realm, especially for those within this unique, vulnerable, time in their life, is attention or respect to the feminine. And I say that because, and just to be clear, it's not like masculine is men and feminine is women, or it's not masculine bad, feminine good. Like we all have that yin and that yang within us, and we have to find a harmony in how it flows. But if you think about the fitness realm, it's very dominated by the masculine. So it's how much weight are you lifting, at what percentage are you lifting, how hard or at what intensity are you going, what are we doing for the day? No conversation with what should I be doing, what feels appropriate. Counting calories, counting macros, like everything is very absolute, numbered, regimented, and like, hello, control freaks, right? Pregnancy specifically calls us into our feminine more than any other time of our lives. And when we're so dominated in a masculine world, like we're being pulled into our feminine, but we don't even know, because we're fighting that to just stay in the masculine. And I truly think it is a form of suffering for your inner soul, because it's like, I want to go this way. This is what's calling me, but you just keep pulling me here. You keep telling me what I need versus listening to what I need. And so when I say the feminine, like more of the creative realm, more like movement for pleasure, what feels good, having a conversation with my body, my intuition, what's coming up for me, what's not appropriate for the day. If I were to drop percentages, or look at a program but say this feels better, So I think that is one thing is like, I feel like women, we get so lost in those absolutes and data and research and science and things like that, that we've been conditioned to ignore our own intuition. And like the second you're pregnant, that mom intuition is so strong and it's talking to you and it's calling you. And like your mother, like no doctor, no midwife, no doula, like nobody knows what's coming up internally except you, but you have to listen. And so that's happening in the gym, that's happening at your appointments, that's happening every time you make a decision. And typically it's not wrong. If I can tell women one thing, it's like trust that motherly intuition. And in hindsight, we can always look back and be like, that was totally coming up for me. And I let fear take over, or whatever. So I would say that is one of the big things missing. And the other is just lack of education. Because it is, you know, more dominated in the masculine realm. Like I don't expect majority, let's say majority of coaches or trainers that are men to want to be like, oh, let me go learn about pregnancy so I can serve the women in my community better. Let me learn how to heal properly postpartum or to help women. That probably doesn't even cross their radars until maybe their own significant other, wife, whatever, is pregnant and they're like, oh, then it might ring a bell. So I think all we can go off of are like misinformation and societal things that say pregnancy is a fragile state. Be careful. Don't lift this. Don't get hurt. And then on the postpartum side, let's bounce back. Let's get you back into it. You know, all of the, and it's the opposite. It's like you're literally a superhuman, like double the amount of blood and oxygen when you're pregnant. Like you are walking around like the most superhuman version of yourself. You're not fragile. But then postpartum, like you need to be taken care of. You need help, you know, down this mountain. You can't just be rolled down. And so I think there's a lack of education and just being too comfortable with societal norms and people telling you, you know, this is how you have to treat a pregnant woman and saying like, okay, I can do that. And it's like, no, that's not it. So those are the two things that I think that really dominate that world.
And for yourself, having all the fitness experience prior to getting pregnant, were you surprised by anything? Because I have really found the intuition piece is huge. And thank goodness, like a couple years ago, I realized that was probably at the root of my health crisis. Personally, was this after so many years of a disorder or an eating disorder, I had gotten so used to shoving down my body's voice and overriding it, and with fitness as well. And so it's been a process of several years of coming back home to hearing my body and following it and trusting that it's right. It's right. And pregnancy has taken me to that, like on that journey to another level. And I'm just curious for you if, okay, you went into it like, okay, I have all this information about what I can and cannot do or whatever being pregnant and what's possible for fitness. And then did you encounter anything where you're like, oh, I thought my body was going to be able to do that, and it doesn't actually feel good and I need to listen? Was that challenging for you? How did that play out in your experience?
Two answers to that. So I think that, so I was, like I said, I'm competitive to a fault. I was an athlete my whole life, and I will compete on a game at a baby shower and like not have any friends when I leave. Like it is just, it's one of my flaws that, you know, for better or for worse. But I had stepped away from the competitive realm about 3.5, 4 years prior to getting pregnant. And I will say that was a huge blessing because I had some time to do some work to get used to not comparing to my former self, like to be able to be in the gym and say, I might never do what I did at the peak because I was training 2 times a day for hours with a coach, like, you know, very structured. And now I get to live my life and I don't have to do that. And like, I'm still maintaining my fitness. So I will say in that realm, I had some years to get used to like letting go of my former self in that regard. And so I felt like my first pregnancy, while there always was, you know, those times that come up where it's like, I just want to show everyone how fit I still am, even if I'm pregnant. It was also the first time that I feel like I remember distinctly one time where I was like the last person, and I hopped in the group classes regularly, worked out with the, the men and women that I coached regularly. And I remember being like the last one to transition to like the next exercise and like being so at peace with it and being like, for the first time, I have nothing to prove. Like, I don't have to go hard. I don't have to go fast. I can just do what feels good right now. And I remember that being so freeing. And that was like the first moment for me to just really embrace that. And then secondly, I will say that there was a time where I thought like I would definitely be the woman who, like, I'm knowing everything. Not that I know everything, but like I know the things. I know when to step back. I know how to train properly. Like I'm gonna do it the right way. And then I remember being like, okay, I'm for sure gonna be able to work out till 40 weeks and be that woman. And at both pregnancies at around 30 weeks, being like, oh, my body's really telling me to slow down, like really telling me. So usually I was prepared to like kind of start tapering down by 36 weeks. And I had a very obvious slowdown by 30 weeks. And that was hard because I was like, you feel that like, I know I need to be moving. I know I need to be training, but I also want to respect what's coming up for my body. Do I rest? Do I lay on the couch? Do I go for a walk? Or am I just being lazy? Do I work out? And having to sort through that. So that was my biggest surprise both times, is just being like, I feel good, I feel good, I feel good. And then 30 weeks came and it was like, you're going to slow down and you don't really have a choice. So that was hard, but also needed and necessary. And I don't regret it.
Yeah. And I'm curious, what were those signals you were getting that gave you a clue in at 30 weeks? Was it, I know for myself, I actually have had a lot of injuries, like physical injuries throughout my pregnancy. And it's just been so hard for me because I want to stay active. I want to be maintaining fitness the whole way through, but I'm 36 weeks now. And I feel my body being like, don't lift another weight until this baby comes. But there's that like fear of losing my strength between now and when the baby comes, and then postpartum, and who knows how long it will be before I get back to working out. So I'm just curious, like my body's been talking through injuries, sadly.
Yeah.
Like you've got to pull back, but was that the case for you, or was it just more really subtle, just exhaustion, or, what was it for you?
It was a little bit of everything because I remember it being very obvious. So it was like, when I did get up and move, it just didn't feel as good. And I was tired, and I just overall felt more tired. But like, I did have that internal dialogue that was like, it's time to slow down. Like you need rest. And whatever it was very strong and very convicting, to where it was like, okay, like I need to have this conversation. Am I being lazy? Because at that point in pregnancy too, you're like, I'm uncomfortable. It's hot as heck. I'm in Texas. Like, am I being lazy, or do I need to just, listen? And so I do remember just my body in general wasn't working the same. I didn't have this burst of energy where I was like, oh, fitness feels so good right now. It was like, I'm doing the things to do the things because I know they're important and I'm getting my fitness in, but also like not respecting what my body's telling me. And a lot of days that was rest or just a walk is okay. And so, yeah, I just remember it being very distinct and very obvious, and me like really having even to have that conversation with my husband, because I wanted him to understand that I'm not being lazy. You don't have to like, I need you to understand too, that when it's time for us to go work out, we do that together a lot. Like, I need your grace when I'm like, no, I don't feel like it. I don't want to hear like, come on, you should get up, you should move, you should do something. Like, I appreciate that, but now is not the time. So I think it was really just some internal dialogue, but my body was pretty much on the same page with that.
Yeah, I think that is just one of the aspects that of, if you are someone who's you go into pregnancy super active, I think that can be really hard to kind of, and it's probably part of the preparing and transitioning into how your life's going to change. Like in a lot of ways, it's not going to look the same, whether that, is fitness or just what you expect of yourself, like you were saying, the competitiveness and being okay with being the last person to complete an exercise or whatever. And I've definitely felt, everyone said that I was like this marathon walker or whatever. And now I walk so much slower. And even something as simple as that, I'm like, okay, I have to just be okay with like, I'm a slow walker now. So that's just the way it is. And, and being okay with the changes that are happening. So
yeah,
I think that is super, super helpful, just to think about and be aware of. I'm curious, as you help coach women in the postpartum phase, if there are women who fare better depending on what physical activity they did engage in during pregnancy, and what do you feel like is most critical if we are going to focus on something specific in our fitness prior to giving birth? What should we be focusing on? What's going to give the most bang for our buck?
Yeah, I mean, I'm always a big proponent, whether you're a runner, whether you're yoga, whether you're already doing strength and conditioning, we need strength and resistance work to help balance things out, to support our ligaments and our tissues as they're expanding. We have relaxin, which is a hormone that makes things a little bit more shifty, more malleable, which is a beautiful thing. We need our bodies to grow and expand, but we have to respect that process. So resistance training is going to be really great to serve what other, form of fitness that you're doing. So I think resistance or strength and strength training kind of lumped together. And some of the big things we focus on in BirthFit is making sure that we're moving in all planes of motion. We live life very much in that sagittal plane, the forward, back, up and down, making sure that we're working side to side, rotational, because we're training for birth. We don't know what positions we're going to have to get in labor, what's going to come up, and you don't want to have to think about it. You want your body to be well versed. And the more that we move in different planes of motion, not always using 2 legs or 2 arms to do movements, or a barbell only, but like working the unilateral one side so that you can help balance out weaknesses and compensations, that is going to alleviate you from a lot of risk of musculoskeletal injury, which nobody wants to be pregnant, much less go into labor and have an injury. So those are all things that I think are super important. And then at the literal core of it, we call them the BirthFit basics, but learning the prehab/rehab movements that we do, but like with the intention of strengthening the core appropriately, learning how to properly diaphragm breathe, how to properly stabilize and brace and manage your internal pressurization. And we like to do that prenatal as like prehab. So we know that our abs are going to expand. We know that our body's expanding and changing, but can we still strengthen and protect the integrity of those tissues so that the recovery on the postpartum side is more streamlined, more ideal? So those are some of the main components. And then just different aerobic capacities. I think walking is so important, but also like, let's get the heart rate up and let's do, quick workouts. Let's do a little bit longer efforts, and let's do something right in between, because labor is that, right? Like a contraction, 60 seconds, active labor, 6-8 hours, and then the entirety of labor could be days. So you kind of have to train all thresholds, but really that mindset of training for birth, so that when things come up, like your body, subconsciously, you've already prepared for it.
Yeah.
And you're not blindsided by like, I need you to get in this deep lunge. We need to do an inversion to get baby in a better position. Being mobile, being able to get in and out of the tub, where it's like, oh, you're pushing, but midwife needs you, or doctor, whatever, needs to get you out of the tub. Like, how quickly and easily can you do that versus needing a ton of assistance and things like that. So I always think about relating our training to actually training for birth, and not just making modifications and changes because you're pregnant, and that's going to serve you best in the postpartum window.
Yeah, I think that I really like how you talked about the difference between just modifying physical activity, maybe that you did before for pregnancy, versus actually preparing for a very physical, endurance oriented event. Because I've just had a really hard time finding fitness for pregnancy. And so I have ended up doing a lot of what I was doing before and just modifying it myself and kind of guessing, which I don't know if you find like that's the case for a lot of women, just because a really good fitness prenatal program, I've just had a hard time finding that. So Would you say that if we aren't specifically training for something, it's harder probably, this is just kind of, I'm fleshing this out. It's probably harder to know specifically what it is we need to be doing that's important, because we're just kind of still working out and taking a step back when we feel we need to, but not really doing things specific for the experience of birth. And if we haven't birthed before, it is kind of hard to know what those things are.
Yeah. No, I think that's great because obviously BirthFit has prenatal programs and they are written, by the week for where you're at, but that doesn't mean that it's the only way. And I also want women to continue doing the fitness they love, to be in their communities. I don't want to isolate them from their groups because they need that. So it is important to know how to do things and not guess, which is why I still love, we have a basics program, no equipment. It's still a way to learn the breathing and the bracing and how to adapt things. Because what I hear a lot of is oh, well, I just still feel really good, so I'm following my program, but I'm not laying on my back and I'm making sure we don't do this. And I'm like, it's okay to lay on your back and you don't have to worry about that. And so it's we have the societal, don't do this, finger wagging, or don't lift over 100, or don't lift over 20 pounds. Don't get your heart rate over 140. Those are so relative and they don't tell us anything, but that's what we know, what we've heard from our mom who's worried about us, you need to be careful. So I think it is so important to seek out a professional in the realm, but also to be aware that a lot of programs take advantage of the vulnerability of pregnancy and postpartum. And so what's the difference in a program? And I'm totally not trying to throw shade, but from what I see being in the industry of just because a marketable athlete, an incredible athlete has been pregnant and had a baby and worked out through it, so now they're selling a program that's here's what I did in pregnancy. That doesn't mean that they know, that they're educated, that they're informed on how to actually train in pregnancy. That's what they did, and that's what quote unquote worked for them. We don't know what they're struggling with, but I guarantee you they're still bleeding after birth. They still have pelvic floor dysfunction. There's still things happening that you might not see on Instagram or in a highlight for a program. Mm-hmm. So that's the big thing is what I think we really pride ourselves on at BirthFit is being the industry leaders. So not being lost, information, we update our programs all the time because the program that we had for prenatal 5 years ago is considered outdated now. We've learned so much, we've evolved, we've grown. I think I redid it 2-3 years ago, and then we just redid it again because as we learn and evolve, it's that's not right, or this could be better. And so I think there's a big difference in somebody who is, working with someone or seeking information. And that's why we have blogs, we have podcasts, we have all of these things because it's we are trained specifically for what you're in. I'm not just saying, well, I gave birth once and this worked for me, so you should try it too, because that's it doesn't work like that. So yeah, I think I want you to continue doing what you love, but take the time to, even if it's a virtual, it's an online consult, or you have someone local near you that understands it. It's worth it just learning those things off the bat, and then take what you know and adapt it into the things that you love to do.
Mm-hmm. I'm curious, where do those kind of just arbitrary guidelines we hear come from? Who's making those rules and why? I'm just so curious, where did they come from?
Well, typically from people who don't work out themselves. So it's I don't know. I mean, I know where some of it comes from, but a lot of it is very blind and just misinformation. It's been debunked. It's old information. So I like to say, think about it this way. Don't lift over 20 pounds. We still have doctors, providers, even midwives, telling women this. But okay, so for the course of the next 9-10 months, we're not going to pick up over 20 pounds. But then after I have this baby, within a week or two, sometimes even sooner, I have an appointment and this baby is going in this car seat. I'm going to lift this car seat into the car in addition to my diaper bag or whatever else I'm toting around. You're going to be lifting 20 pounds and your core is going to be completely shot and you're not going to have any strength to do it. You're more likely to have core dysfunction, pelvic floor dysfunction, injury because of those things. It's like, it doesn't make sense. And it's like a doctor telling someone to never squat again. It's not safe, but it's like, well, you go to the bathroom every day, you get in and out of your car. Like, we need to know how to squat, right?
Yeah.
So, some of those blind recommendations, I think, just come from lack of information, misinformation, and honestly, like, some of it is just, and I don't mean this in a rude way, but it's just stupidity. It's like, but does this even make sense? And I think that's a question we always need to be asking. And if we don't align with our provider in that realm, like, it's okay to find a new one, because you need someone to support how you're going to do things.
Yeah. And especially if you do want to maintain a level of fitness throughout pregnancy and not take this 9-month period off, like, if anything, I mean, then you have so many physical components, like you said, after the baby comes. I mean, I even heard, thankfully, like early on in my pregnancy, this other podcaster talking about how she did not train her upper body enough for what the breastfeeding journey was going to entail, and how she was in so much pain. So she's like, that is my number one recommendation for like moms, is like, really, really strengthen like your back. Because it was just brutal for her. And I was like, okay, I'm glad I heard that now, because I would have not thought of that, but that makes so much sense. So I think it's really important to think ahead and prepare, because maybe you weren't specifically training for having, strong back muscles for breastfeeding before. So now's the time, sort of thing.
Yeah.
I think that's really important. I'm curious, in your own experience with postpartum with your 2 kiddos, what did your healing and recovery look like from a physical standpoint and an emotional one? What was your journey like?
So they were both similar, but a little bit different. And I'll hit on the things that were the same. And this is an area where I'm so grateful I had the education that I did, because, well, we'll get into it. So I knew going in that I would have a lying in period. And what that is just lying in bed, not getting up except to use the restroom, co-regulation, skin to skin, nursing as much as possible. Like, I knew that that was very important for me. And so the first time, I mean, you don't know, you're like, we own a business. My husband likes to be there every single day. And so it's like, I think he's like, I could take that first week off. And you're like, yeah, a week should be good, maybe 2. And then the second time, he's like, I'm going to take a whole month off, because he knew like how helpful that was for me. So in that period of time, like, co-regulation is so important for baby long-term, for mom, for breastfeeding. So I knew that at minimum, I was taking a 20-day lying in period where it was not really doing anything, staying horizontal outside of, going to the bathroom, things like that. I will say one of the biggest helps, and I'm so fortunate to have, a husband who had the ability to do this, but I didn't change a diaper for the first 2 weeks. Like, like, this is overnight. Like, it was part of him learning how, like, because a lot of times I think the partner is more like, well, you're nursing and the baby wants you, so like, what can I really do? And that was an area where it was like his bonding time. It was like, oh, so even if it's, you're on that every 3-hour window of like, wake up, change a diaper, feed, put him back down, wake up, change a diaper. And every time I would wake up to do that, he would get up and change the diaper, hand the baby to me. He would go back to sleep and I would nurse and put the baby down. And so that was so helpful. And I remember there being a point where I was like, I should probably change a diaper so that I like know what I'm doing. But that was great. And then the other thing is, he was like and my husband cooks 100% of the time in our house. So I have that going for me too, but he knew what I wanted. Nutrition is so important to us, and nourishment, I like to call it, like nourishing food, bone broth, stews, porridges, shepherd's pie. Like, he had everything ready and was just, I never had to think about food. Like, it was always there, and that was huge. So I will say the second time I did something very specific. I followed Valerie Lynn, the postpartum, I'm drawing a blank right now, but she was like a postpartum guide, like a 30-day guide. And she has a kit. It's an eco postnatal kit. And in that kit comes herbal baths, a different kind of herbal bath, different tinctures, some teas, some body scrubs, some coconut oil, like all of these things, and a whole 30-day calendar and plan, as well as a recipe book. And it was literally, and she has a more condensed, like 18-day one, but we followed that. And it was like, sometimes it was morning and night. But for the first 30 days, we had it planned out to where it was like, my husband had that calendar. He had all of the things set up, and it would be like, I'd wake up and he'd be like, okay, you do an herbal bath this morning. Here's the tea that you drink. When you get out, rub this on your belly. And like, that was so, it was like a spa in my own house. It's like, okay, 20 minutes without the baby, have a bath by myself, drink this tea, like rub on my body, some belly massage, you know, all of that, get warm again, and then get back in bed and get the baby. And then he had like the food stuff. So it was really, really cool to actually have like a set out plan, and really helped me like honor that time, especially the second time, because she did come so quickly and it didn't feel like I gave birth, to be honest. Like it was just like, it was like I could get up and do things. I was still bleeding and things like that, but it was so minimal. And I remember being so sore the first time and it taking, you know, some time to just get back into my body. And I remember the second time being like, I'm good. Like people can come over. I could vacuum. And then it was great that I had like a written out plan that was like, this is what we're doing. So aside from that, that was kind of more, like I would say that was hugely emotional for me in a good way. And the biggest thing that I correlate that with less, you know, postpartum blues, depression, anxiety is the support part. And like, it didn't necessarily have to be my husband, or it doesn't have to be husband partner, but could it be a friend, a sister, a mom, like having that help for you, that support system, so important. And I'm so grateful that I did. And then on the physical side, like I truly did like not just plugging it, I did the birth fit postpartum plan to a T, the lying in, the basics, and our postpartum training. And again, like I write a lot of it, so it's a good way for me. Both times I refined it after each of my postpartums, because it was like, I'm in this, I'm feeling it. I know there's no exceptions. Like everyone who gives birth is going to be feeling these things. And so it was cool because that timeline takes you through about 5 or 6 months. So on like the physical, the fitness aspect, I had 5-6 months already written out and planned for me. And I can't be happier with where, you know, it got me to that point to just then start to resume doing the things that I love.
Would you say that you ever returned to fitness in the same way that you did prior to giving birth? Would you say, just in your experience, I mean, it sounds definitely, I'm going to encourage people to check out Birth Fit, because having a laid out plan like that in postpartum, I'm sure is super, super helpful, because it could probably feel pretty daunting depending on your labor experience though. I think that's really fascinating too. You said like one of them, you could feel the slowdown. The other one, it was like, I had to slow down, even though I didn't feel that like same way. So yeah, what expectation, or would you say it's better to have no expectation, should we go into the postpartum when it comes to recovery from a physical standpoint?
Yeah, so one of the things that we say a lot is like, there is no standard rehab protocol for birth in America. So cesarean, major abdominal surgery, birth through the vagina, like a vaginal birth, is greatly traumatic to the body. And there's no other medical event where we don't have outlined 2AT plan, like post-op, right? So imagine getting like ACL surgery. You have a 2-3 inch scar on your knee, and you know, from the time you get out of surgery for like the next 2-3 months, you have a rehab protocol. You have to start moving. You have to go see PT. Like they have this written out. We don't have that for birth, but birth happens all day, every day. And so I would say that our postpartum package is the standard rehab protocol that we think people should have to recover from birth. And so it starts with 30 days of lying in, because we really want to honor that lying in period. In other cultures, it's 3 months, it's the whole first year. Like in America, we're just fast paced, and Then like we don't have paid leave. So women have to get back to work, if they even get 6 weeks or 12 weeks. It's not even realistic to take 30 days. So we put that program out there because we're like, if more people could just have the intention of like lying in and honoring this process for 30 days, it's going to change so much. So it's something that some women start as early as 24 hours after birth, depending on the birth. With cesareans, we see a week or two after post-op, and it's breath work, it's energy through touch, belly massage, lymphatic drainage, different things that you can do on the floor with your baby next to you. And for those who really struggle to just need something to do, it's a great way to have a plan, but have it honor and respect this period of time. And then we go into the basics, and the basics is what I would say is like our standard rehab protocol. I want everybody to do our Birth Fit Basics program before they go back to whatever they want to go to. And so we think of that as like the foundation. You can't, like, you wouldn't leave ACL surgery and then get cleared at 6 weeks and go run your first 5K. Like, you just wouldn't, right? And so it's like we have to do the basics, the slower things. And so it's resistance training, but it's just with your body weight. It's no equipment, 20, 30 minutes. You can do it in your home, but you're building a base again. You're building a foundation with emphasis on breath, core, pelvic floor, all of those things. And then the postpartum training is more getting you back into general fitness, strength and conditioning in a slow 12-week build. And I think that's so important because we know that tissue on average takes 280 days to heal, which is pretty much the length of a pregnancy. Wow. And so we like to say, like, your immediate postpartum is for as long as you are pregnant. And that includes loss, whether it's, earlier loss, whether it's late term, whether you went full term, you still, like, your body still changes the second you're pregnant, and you have to heal from that. So we like to say the whole first year postpartum is the immediate postpartum, not 6 weeks and you're cleared. Because again, like, what does cleared mean? Does that mean I can go run, lift weights? Does that mean I'm okay to walk and start gentle movement? Like, there's no clarity there. So those are things that I think are necessary in some capacity. And I will just say that in my experience in working with many, many women, those that do the best long-term post 1 year and like make the most strides, getting back to what they love, getting better than maybe they ever were, like professional Olympic athletes we worked with, took that time to literally do all three of those things. Like, I'm telling you, we worked with someone on the USA national soccer team who they did the Olympics in 2021. And so she gave birth in late 2020 and needed to be ready for Olympics in 2021. And like, that was our non-negotiable. It was like, great, we will help you get there, but these things have to be done. And she stuck to it and she did wonderful, right? And so it's almost like slow is fast. If you can trust that process early on, it feels slow. And I know you have those people tugging at you, like, you want to bounce back, you want to lose the weight, you want to like be your previous self. Like, you will never be that. You birthed yourself into this new realm. So accepting that, but knowing that you could potentially surpass that or feel really good in your own body again, but it's going to pay off to do that work early and upfront, and to just be patient and give yourself the grace.
Yeah, we do. I think that is so helpful. The perspective of how long it takes tissue to heal is, roughly around the time that most women are pregnant, if they go full term and all that. And I think because we do have such a bounce back quickly mentality, I remember, I can't even think of the book, but he talks about like the first 40 days or something like that.
First 40 days.
Yeah. I think that is the title of the book. And how culturally this is actually normal, like around the world for so many people. But in America, it's like we have this, a couple, I mean, at this point, some companies at least give fathers like 2 weeks off for paternity. But still, like, I think as the more I'm hearing the wisdom of wise elder women who have, they're midwives or they've given birth to several babies, they're like, you're not better, you're not like back to your bouncy self in 2 weeks. Like, you're still going to need support, even if that isn't, maybe if it's not able to be a spouse or a partner. have a plan going into it. Don't expect yourself to be doing it all again, like at the 2-week mark. And I think what you were talking about, the eco postnatal kit,
yeah,
is a great thing if you want something really tangible to outline it for you and just, this is what you do. Okay, I can follow this, I can do this if I have a plan. I think that's a great thing for people just to think ahead about. And I mean, lucky you that your husband cooks full time, because I think that's a huge one. Like if you're the main person preparing all of the meals for the family, that can be really hard. So
it's a lot, and it's a lot of pre-prep work that has to be done, and that's the reality. But yeah, it is. It's really sad that this is our reality in America, that we can't do better for women. It is, and like just the general, like the World Health Organization just came out and finally said, like, you should breastfeed your babies for 2 years. Like there's all of these benefits, but then it's like, but women have to go back to work by 6 to 12 weeks. And every time they go to appointment, their, babies are being compared on these size scales that have never been on, like, there's never been data done on exclusively breastfed babies. And so you're going to tell them they're not getting enough. And then you're going to encourage supplementation, and there's no paid leave, and you got to get back to work, but you should breastfeed for 2 years. And it's like, that's not possible. And that's
not
setting women up for failure. And like, look at our postpartum, anxiety, depression, like all of the things that are going on. It's like you're setting women up for failure if they don't have that, and they don't have the support. They don't know, like, you need a lactation consultant. You just 100% of the time, you need a lactation consultant. And like, if you can make it work, one that's out of the hospital, that can come to you, that's trained, differently. And like, nobody tells anyone these things and how hard that it's going to be, but then you're going to like set this bar and say, but you should do this. And it's like, like we're failing so hard right there.
Yeah. Oh, that's so fascinating just to kind of uncover. It's such a rabbit hole if you go into the politics of birth, for sure. And I love, on the Birth Fit podcast, there's a lot of really interesting conversations that go into that. Yeah, that will totally go there, because I love it. I'm so fascinated by all of it. I was thinking it'd be beautiful if you could close out our conversation today, just sharing what you're learning in the school of motherhood lately. I know your kiddos, how old are they now?
3.5 and 16 months.
Okay. Still young. You're still in the trenches for sure.
Yeah.
But what would you say are some of the biggest learnings you're having right now as a mother?
I will say the biggest learning, and we've already touched on this, but it's the motherly intuition. It's knowing that, like, all of the information that you have out there, you have your pediatricians, your doctors, the people who have given birth, like all of your trusted people around you. But like, everything you need to know is already within you. And so gather that information, gather that data, like let the professionals do their thing, but always come back and see, like, sit with yourself. I've had to do a lot of that with my son. He had some, like, not severe, but some developmental delays and some speech delays and things that like would have been really easy to brush off as like, it's just a developmental delay he'll grow out of. But like, that's not me. Like, what doesn't sit right with me is like, but why? But what's causing it? And like, to continuously dig. And I will say, we went down so many rabbit holes and did so many different things and spent all of the dollars and whatever. But now we have like the most perfect team. And I will say, within that team, we have a more medically minded person, someone in the middle who's kind of both, and someone who's very non-medical, and they're all on the same team. They love and they support each other. And I love hearing their opinions, but it's really allowed me as the mom to be like, I have all of this information now, knowing my child the way that nobody else can know them. What's coming up for me is, I think this is the right route, or we're not going to do this, even though you all think we should. This is the route we're going to go. So just really like fiercely trusting and advocating for your kid, and knowing that like, if it's coming up for you, it's probably right, and trust it and follow it. And so I have found that to be one of my biggest learnings as a parent, is like fear, like making decisions out of love and not fear. We say that a lot in Birth Fit, and like fear can totally take control. But again, within, like, you always know the route to go. And so that's been my biggest learning to date as a mom. And then in a more fun way, I would say, just the funny part is more like how much of a sponge kids are. And you start to see the reflection of yourself and the things that come out of their mouth. And we're finally in that stage with him where it's just like, oh, where'd you learn that? And that's been really fun, but also humbling, because it's like, oh, okay, now we have different hurdles to come. But I don't know, being a mom it's so hard, but it's so amazing too. And I just, yeah, I'm constantly learning and going down the rabbit holes and enjoying it, but also like trying to stay present and not be overwhelmed by information.
Mm-hmm. Would you say your intuition has gotten stronger as a mother, like, than before, or was that something you always felt really guided by?
Definitely stronger once they were physically here,
Mm-hmm.
because I think you just know them a little, like, you know them as a soul and like as that being inside of you. But once they're physically here, it's a different connection. And like, I can just think back to every single decision that we made from the time they were born. It's like something in me was saying, I'm not okay with this. Are you sure you're going to do this? Is this okay? Is this what you want? Is this what you think is best for them? And so I would say that it definitely gets stronger and stronger, especially when there's more of like, I don't want to say a problem, but there's something specific you're working on, versus just generality, like being a mom. Like there's going to be random stuff here and there, but like when there is a specific thing that you're trying to get to the bottom of, like for me, it's just gotten stronger. And but I've also just gotten so much better at saying like, this is what's coming up and this is what we're doing, and not trying to second guess it.
Mm-hmm. I mean, that's one of the beautiful things I have noticed in pregnancy, even, is just like how much clarity I have about what is a yes and a no. Like, and it feels really different, like in some ways. I mean, I had spent a lot of time prior trying to fine tune, like listening to my inner voice, but in pregnancy, it's just so clear. It's like we were close to actually relocating to Texas right at the end of my pregnancy. And I went to Idaho for my baby shower and came back, and that was at like 34 weeks or something. And I just had this, like, you cannot fly again. Like just everything in me was like, travel is not right for your body, like going into it. And so that was really challenging, because our family was like going to try to pull off this huge move right before, like at 36 weeks. I was like, it's not happening. No, it's not happening. That's a clear no in my body. The baby says no.
Yes.
Which I just think, yeah, I mean, practicing that in pregnancy, like, just sets you up better for going into motherhood. And I'm sure you're right in that once they're right there in front of you, it's probably even louder, that voice that's talking.
Yes.
Like, this is a yes, this is a no. So
yeah, it definitely is. And it's, I would say it, the more that you do listen to it, and then you're affirmed by, like, when things play out and it was right, the more you just really start trusting it. And then I think you're more willing to hear it. You're more willing for it to come up. So maybe it was this strong all along, but the more that we, dug through and went through, the more open I was to hearing it. And that's maybe why it's, stronger and stronger as they get older.
Mm-hmm. So beautiful. So many things covered in today's conversation. Thank you again, just for sharing your wisdom and giving us kind of a world into what you do and how you're supporting women. Is there anywhere specific they could go to find you and to either work with you? I know you said you do a lot of online programs, so maybe all over the world, people could work with you as well.
Yeah, so you can definitely find all of us at birthfit.com or Instagram at birthfit. We have a wonderful podcast, blogs, online programs, and you get to see a lot of me there. And you get a lot of access to Lindsay and I too. We're very open and available in that regard within our women's community. We just started B Community, which is for all women. So not even those of you that aren't necessarily just pregnant or just postpartum. It is fitness, it is education, it is community for women. So that part's really cool. You can find us there. We do online, I do like consults through BirthFit as well. And then I also teach birth education through BirthFit. So all of that's in the BirthFit. And then if you want to reach out to me personally, my Instagram is Leah_Barto, Barto, and I'm pretty accessible there too.
Well, thank you again, Leah, for being here. It's been a pleasure chatting with you.
Yeah, thanks for having me. I really enjoyed it.